of the common mwananchi. Milia Kisienya, KTN.
Now, patients seeking treatment at Kenyatta National Hospital are now being forced to pay more for some medical services following a revision of user fees. While health experts say public hospitals have the mandate to review charges to keep up with rising operational costs, patients argue they should have been informed before the new rates took effect. Tonight, we examine the delicate balance between keeping hospitals financially sustainable and ensuring healthcare remains affordable and accessible.
For many Kenyans, Kenyatta National Hospital is the hospital of last resort, offering specialized care that is often unavailable elsewhere. But some patients arriving at the country's largest referral facility this week found themselves paying more than they expected after new charges for several services took effect without prior public communication. Among those affected is this mother who says she spent the entire night sleeping on a bench with her anemic baby after discovering she could not afford the revised consultation fee.
Venye nilifika kuliko nishughulikiwe niliambiwa lazima nikuwe na registration ya 1850 na ile sikukuwa nayo, nilikuwa sina hope nikikuja hapa.
Others say it was not necessarily the increase itself that frustrated them, but the lack of notice.
Ona daktari unapata hii ada imeongezeka. Kama ni kupimwa umepata imeongezeka mara 3 ama 4.
Kwa hivyo inamaanisha nini? Ya kwamba maisha yako itazidi kuwa magumu na hata kama unataka kupata matibabu haitawezekana.
Patients lament that they've allegedly been forced to pay at least 25,000 shillings for colonoscopy they initially accessed at a cost of 9,800 shillings at the facility. Others include endoscopy, a common procedure that doctors use to examine structures inside the body using an endoscope, often fitted with a light and special camera. The cost of this procedure, according to the new rates that allegedly took effect on April 2026, is now 20,000 shillings, up from 6,500 shillings that KNH would charge patients. Those seeking services at the hospital will now be forced to pay a consultation fee of 1,550 shillings, an increase of 400 shillings of the initial amount, among other services whose costs have been raised. While the issue is raising concerns among patients, healthcare advocates say there is no legal framework preventing public hospitals from reviewing their fees when operating costs rise.
And the board sits down, there are things that they sit and look at. How is a hospital running? The budget allocations they're getting from the government. Of course, there's what SHA reimburses. And at times you come and find that when the board sits, they find that the hospital is going down.
However, Eunice Chege, an advocate, says legality is only one side of the debate. The other is accessibility. This is particularly concerning because accessibility to healthcare is measured not just by whether services exist, but also by whether people can afford to use them. And any delay can turn manageable illnesses to medical emergencies, ultimately increasing both health risk and treatment costs.
I think a health commission would really be the best part to address all this.
Dr. Simon Kigondi, who is currently the president of the Kenya Medical Association, says periodic adjustment to user fees are not unusual and are often driven by the rising cost of delivering care. He says the best protection for patients against unexpected medical bills is adequate health insurance. But he also adds that the responsibility does not rest with patients alone.
One of the consequences of non-payment by SHA or other insurances is that you may need to raise your prices to be able to cover for the expenditure that you have incurred in running the cost.
The debate now centers on a difficult question. How do public hospitals recover the true cost of delivering quality care while ensuring that the very people they exist to serve are not locked out because treatment has become unaffordable? For many patients at Kenyatta National Hospital who arrive expecting one bill and found another, that balance remains painfully personal. Gloria Milimu, KTN.
Now, more Kenyans have arrived back